AP. All right, it is October 10th, 2023. I'm Dr. Deuk Majan. We are performing the cervical Deuk laser disc repair on a patient who's traveled here from Canada. And he was supposed to have this procedure done last week, but our air conditioning system went kaput. And so he's here today to get it done. He actually 2, 3, 4, 5, 6. Everybody agree we're at 5, 6? All right, let's get one more AP view. He had his lumbar done last week, and he has 100% pain relief from his lumbar Deuk laser disc repair for his herniated disc. Now, today, he's getting his cervical. Perfect. We're right in the middle. Show us the midline there. You can see the spinous processes, and we're right in the middle at the front of the disc at C5-C6, right where we want to be, lateral. So I'm going to advance my needle into the disc. He has a herniated disc at C5-6 shot. It's actually on the right side. He has right arm symptoms, and we like to start on the opposite side. Let's count our bones on our lateral Henry. 2, 3, 4, 5, 6. Now, he had a car accident years ago, right? You can see he had a fracture of C3. Show us C3. You guys see how compressed it is? Show us the top to bottom. There it is. See the height there, top to bottom? Is smaller than it should be. So it was fractured. All right, let's get our discogram done. Shot. Big tear. Shot. All right, show us the tear there, Jordan. Can you guys see the tear, Henry? The black line, that's the annular tear.
Yes, we can.
That's where all the pain in his neck is coming from, and that's where his herniation went out through that tear. So we're going to go clean up the tear and remove the herniation. Henry, let's show the audience how a herniated disc or a bulging disc, which is a herniated disc, how do they cause so much pain? Welcome back, and now you understand why herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, all the same thing. It's a tear and a herniation, inflammation that causes pain. We're going to go remove the source of inflammation, which is the annular tear and the herniation stuck within the annular tear. We're also going to remove the part of the herniation sticking out. All right, shot. So at this point, I'm advancing our dilator through the front of the disc. I'm taking the guide wire out. We don't need it anymore. And I'm going to gently tap, and the dilator is shaped like a pencil, at the tip. So it spreads the tissues of the annulus apart. And we're advancing now through the disc to the back of the disc where the herniation is. Show us the herniation there, Jordan. Can you guys see the herniation there? Look how big it is.
Yes, we can.
Yeah, you can now see it because we put some dye around the herniation. So I'm going to gently advance this tip right to where the herniation is. Now, let's show the audience here, Henry. We're going to do the entire surgery on the neck through a tiny little tube. You guys see the tube here?
Yes, we do.
This tube is literally 4 millimeters wide. So that's why we're able to do the surgeries minimally invasive, because we don't need much room to get it done. And by doing it this way, we're not removing the actual disc. We're not doing a discectomy. We're doing basically what's called a herniectomy and an annular debridement. Now, herniectomy is a procedure where the surgeon only removes the hernia, nothing more. Typically, with cervical spine surgery of this type, most surgeons will want to actually remove your whole disc, and in doing so, they're destroying your spine, and they have to do a fusion at that point. But I learned this endoscopic technique from the Koreans, the South Koreans, specifically Dr. Seng-Ho Lee, the founder of Woodydal Hospital, and Dr. Gun Choi, who was his #1 right-hand person at the time. And I learned this from them 17, 18 years ago now. All right, I could use a little inline traction at this point, Dr. B. So I'm going to advance the tube now along the dilator to the back of the disc. But I've got to keep an eye on the tip of the dilator to make sure it doesn't go in. And Luis is going to help me with that. All right, you can see the tube advancing. And we're just doing little taps, and my team is pulling, and I feel that it's actually helping. He's got a lot of scar tissue in the disc, actually, more than I expected before. Can you guys, are you guys giving me inline? Yep. Okay, shot? I think it got a little blurry. All right, so I'm gonna have to pull the dilator back a little bit. Shot. I could always advance the dilator later, so I'm going to get it back to a safe place, and then we're going to go back to advancing the tube over the dilator. Shot. Dilator's advancing again. Keep an eye on it. Luis, too much? Yeah, I'm going to bring the dilator back. That's why you got to always watch the dilator, because you don't want to advance it into the spinal cord. That would be very bad. So right now, the reason why it's difficult to advance this, he doesn't have a normal disc. He has a shot. He has a scarred up disc, and that scarred up disc is holding onto the tube, keeping it from advancing, and it's also trapping, getting little pieces of scar tissue between the dilator and the tube, so it's making the dilator advance with the tube. When the tube is supposed to actually slide over the dilator. Almost done. Shot. All right, so we just got a little bit more to go. Shot. Just about there. Any questions?
No current questions.
All right, I think that's it. I don't want to go any further. That's perfect. Show us, Jordan, the tip of the tube. Shot. Yeah. See the tip right there? It's at the back of the disc, right where the tear is. So we're going to use this tube to take us to the back of the disc herniation, right where the herniation starts. We're going to use the laser to remove the herniation. All right, let's show the audience, Henry, just how the Deuk laser disc repair actually works. This is a procedure that was developed at Deuk Spine Institute. We've been doing it for 17 years here, and we've had 1,700 procedures performed. You're pretty amazing. All right, welcome back. You can see what we're doing with the Deuk laser disc repair is we're essentially using a laser, which is the most precise tool in all of surgery. We're using a laser to debride or clean out the tear that happens with trauma at the back of a disc that allows the herniation to pass through the tear and cause all of its symptoms. And that's what we're looking at right now. We're looking literally at the back of the disc in this patient. You can see the tear. You can see the blue dye. That's the Deuk Spine Blue. And we're basically using the laser to clean out the herniation. I was talking to the company that manufactures the laser yesterday with Luis. And that company is called Luminous, but they were bought out by Boston Scientific. And Boston Scientific is now, unfortunately, raising prices and making it harder for us to get the laser and what we need. So we had a meeting with their team, and we were discussing the history of the use of the laser in spine surgery. And because I'm a pioneer in this technology, he was asking me about my experience using the laser. And I was telling him that with this laser configured this way that we use it, we're able to basically ablate tissue, which is really what surgery is about, right? It's about removing things that shouldn't be there and repairing things sometimes. That's why they're called ectomies. Yeah, ectomy. Yeah, you're right. And yeah, he was asking me about the precision in which I can use this laser. And I told him I can literally peel off tissue 1/10 of a millimeter thick. There is no other tool in medicine that has that precision. Okay? And of course, it's not just the laser that allows me to do that. You actually have to be able to see what you're doing, which I can see because of the endoscope. So they're needed to be used together. Let's put it that way. The laser by itself is not enough. It's a tool that's extremely precise, but if you can't see at that precise level of detail, which is what the scope allows, the endoscope, then it doesn't matter how precise the laser is, you're never going to be able to use it precisely. Does that make sense? It's kind of like having a rifle and a rifle without a scope. Think about that. There's the tear, by the way, where his herniation went out. So that is the tear in the posterior longitudinal ligament. That's the spinal cord right there, that white thing we're seeing. So he actually has a traumatic tear from his car accident many years ago. How many years ago was it? 5 years ago. Makes sense. This looks like a 5-year-old damaged disc. So he had a car accident and he tore the disc. He got an annular tear, and that's what we're fixing now. And that's also when he got the annular tear, he crushed the nucleus and broke it up into little pieces that are damaged pieces. And those little damaged pieces pushed into the annular tear, like you saw in the video, and it created what's called inflammation. And inflammation is basically your body's attempt to remove something that shouldn't be in your body. So the inflammatory system saw those pieces of herniation and said, we got to get rid of this. So it attacked it, okay? And as it attacked it, it created scar tissue and pain and calcium deposits, which we're seeing here. It created a lot of damage. It's kind of like war going on right now with Ukraine and Russia. You know, when the Russian troops come into a city, they start bombarding it with bullets and missiles and mortars, and they destroy all the normal structures, all the normal churches and buildings and businesses and homes. They're all destroyed. Same thing in Israel. What's happening right now with Israel and Palestine. Just in the news, okay? War is destructive, and there is a war that goes on at the back of this disc when you have a herniation. It is your body's inflammatory system attacking what it considers to be a foreign invader, the enemy, which is the nucleus pulposus. So, is this the first time anybody's heard about your body attacking itself? No. We have lots of situations like that, right? We all hear about autoimmune diseases. That's where your immune system attacks your own body. Well, you have these conditions like rheumatoid arthritis, same thing, where your body's inflammatory system is attacking itself. And that's promulgated by the immunological system identifying tissues as foreign and then sending the what is it called? What was the Gestapo, the division of German soldiers that went out and did the bad things, okay? The SS. I don't remember what it was, but point is there's the intelligence side, and then there's the soldiers that do the actual fighting. And in your body, the intelligence side for inflammatory diseases like this is going to be your cytokines going out and saying, we got a problem here, and then it calls in the troops. And the troops with this disease are called PMNs, polymorphonucleosides. And another name for them are neutrophils. And their job is to basically destroy everything in the area. And that's what they do. So your body's PMNs come in, called in by cytokines, the intelligence side, the planning side, and you start to attack your herniation here and the tear, okay? And that's what we're here to clean up. The sooner we get rid of this herniation, the sooner the inflammation and pain go away. I think we're done, Dr. Berndez. So, yeah, I'm sorry, I should have told you a little sooner, but I think we're done. I'm just going to go one more time and look, but we're done pretty much. So our patient is asleep. He is under gas anesthesia. Don't ask me whose gas it is.
It's my gas.
So what gas do we use for this?
Sevoflurane.
Sevoflurane. And why do you choose sevoflurane?
Because of the speed and the fact that it's non-noxious to the lungs, non-irritating.
So it's non-irritating,
Less of an emetogenic profile.
doesn't cause as much nausea and vomiting after surgery.
Speed of onset and speed of offset.
Speed of onset and speed of offset. So that's our anesthesiologist extraordinaire, Dr. Berndes. And yes, the cervicals we do put to sleep under general anesthesia because they need to be completely not moving, and the only way to do that is with general anesthesia. Any questions?
No current questions.
All right. Do we have any viewers?
Yes, we do.
All right, good. Well, welcome. You're allowed to ask questions if you've been watching and maybe this is the first time you're here. We do these broadcasts and we do them live so that, number one, people can watch a live surgery, but also so that people can ask questions of me while I'm doing the surgery, so I can answer them for you and provide you with more information. So you're welcome to type up a question. Henry will read it to me, or Sanjay, whoever's working the broadcast today. I know that Sanjay is busy, so it may be Henry for a little while. Henry is an expert at doing these broadcasts. He's been doing them for years. Actually, not years. How long have you been here, Henry?
It's coming up to a year and a half.
Ah, a year and a half, so almost years.
Almost, correct.
And Henry is the one who does all of our video testimonials, by the way. All the latest ones, and I think the best ones. I always enjoy watching his work. All right, so there's that where the herniation went, right against the spinal cord. And those fibers right there that I'm peeling off are posterior longitudinal ligament. And I'm just checking to make sure there's no big piece of herniation up against the spinal cord here, okay? But that right there is the spinal cord. And I don't see any herniation down there. It looks pretty good. I think we got it all. Let me just flip one more time towards me. This patient came from Canada. Where in Canada is he from? How are we doing on the irrigation? Yeah, I would keep it going for a minute because I got to float out a couple of pieces here. Where is he from in Canada? Toronto? Is it Ontario? All right. Yeah. Just want to make sure we don't leave anything important back here. That's all the torn fibers of the annulus I'm cleaning right now. You guys see that? Those like little finger projectiles.
Yes, we
I'm
do.
zapping. They're torn. It's torn annulus. So it needs to be cleaned so that it can then heal. Because the way it is right now with the blue stuff, the herniated stuff, it's not going to heal very well. All right, looks good. Well, let me just see here. You see how the annulus is quite deep. And look at the little calcifications there. That's from chronic inflammation causing dystrophic calcification. Dystrophic calcification is basically your body seeding the tissues with calcium deposits. It shouldn't do that. It only does that to abnormal tissue, damaged tissue. You never see that with normal tissues, only with damaged tissue. 1 minute. We doing all right, doctor?
Yes, it's doing well.
I figure I have a few extra minutes since I didn't tell you early enough.
He's just on a little autopilot here. We're cruising in for the landing.
All right, great. Our next surgery, folks, is going to be a lumbar. Actually, it's a DPR, right? And that one is going to be in the other room or in this other room. So we're not going to broadcast. So, yeah. So our next case will be a DPR in the other operating room. We don't have a camera in there. We're not going to broadcast it. But then we'll be back in here for a lumbar Deuk laser disc repair. Yeah, 2 of them when we come back. If you have questions, I recommend you ask them now. Let me show you what blood loss we've had, Henry. Show the audience. Can you see this, Henry?
Yes, we can.
2 drops of blood, folks. 2 drops of blood. You guys see it right here. It's nothing. This surgery is basically a bloodless surgery. We have Jehovah's Witnesses. They love to come here and get the surgery done because we don't lose any blood. We don't use blood products. So we have a lot of Jehovah's Witnesses that are very interested in this technology because they want to get their neck and back fixed, but they don't want to worry about being transfused. And we've never done a transfusion. I've never done a transfusion in 20 years of operating because we don't lose blood like that. Other doctors do. It's funny how so many surgeons don't even care about blood loss, you know? They don't give a damn. How often do you have spine surgeon coming to you saying, hey doc, during this case, let's monitor the blood and try to keep the blood loss to a minimum? You never hear that because they're not taught to do that. But for us, since we're doing outpatient surgery, we cannot have too much blood loss. So for years, I've been paying attention to blood loss and trying to find ways to reduce it and minimize it. Yeah, keeping the blood pressure stable and low. All right, Henry, let's show the audience the incision. You ready?
Yes, sir.
Look at that right there. Okay. 4 millimeters, 4.5 millimeters. You see that?
Yes, we do.
Wonderful. So that's it. Anywhere else he would have had a fusion done with a big incision, scar tissue, complications, metal plate, loss of movement. But now he's going to have normal movement of his neck because we didn't do any fusion. We just helped his body heal something that it's been trying to heal for 5 years. That's what the Deuk laser disc repair is. It's a help to your body to heal something your body can't heal on its own. Good job, everybody. Thanks for your help. We'll see you in a little bit in room 2. Henry, go ahead and take questions. I'll come there and answer them, okay?
Copy that.
Good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute, here with one of my patients who traveled from Mississippi.
Yes, sir. Oxford, Mississippi.
Oxford, Mississippi, which I've never been to Oxford, Mississippi, but I'm sure it's a lovely place.
Very nice.
And why did you come to Deuk Spine Institute here in Florida?
I'm having issues with my lower back, shooting a pain all the way down towards my elbow, as well as having a little bit of stumbling while I'm walking within my left leg, and went to other physicians to look at my spine, whatever, and they wanted to do fusion and all kinds of other nonsense that I thought maybe there might be a simpler way, a process of doing things. Did a lot of research and found Dr. Deuk here.
And what do we do for you?
You guys did a C3, I think 3-4-5-6 at the Deuk laser disc repair surgery.
And before surgery, you had neck pain?
Correct.
For how long?
It's been ongoing probably for about 5 years.
And then pain going from your neck into your right shoulder, down your right arm?
Correct, just getting progressively worse. And that's kind of what made me finally to say I got to definitely do something about it.
Here we are less than 24 hours after your surgery, the Deuk laser disc repair. You can see the incision right here, it's 4 millimeters. And do you still have that neck pain and pain in your arm?
No, sir, zero pain.
Gone?
Gone, completely gone.
Cured?
In shock. Results better than I actually anticipated, which is a good thing, right? That's what I'm here for.
Well, I'm not shocked. It's what we expect to see typically, which is good. The procedure works, and that's why we do it. It works better than anything else. Were you offered any other treatments?
Yeah, they wanted me to go look at a, what do they call, a spinal deformity doctor. And they possibly looked at like doing rods and pins and, and all that kind of good, the fusion and everything. So it just kind of...
Why didn't you want to do the fusion option?
Long time recovery time and just more of a difficult surgery.
Yeah.
Much more difficult surgery. And me working at a house, I still want to have good quality of life in the future.
Yeah. Well, fusions have complications, a lot of complications. Scar tissue, bleeding and pain. Are you having any pain right now from the surgery?
No, not at all. Just a little stiffness when I turn left to right, but that's par for the course.
Yeah, the stiffness is going to take some time to work out.
Sure.
You've had a bad arthritis in your neck. Your discs were degenerated. You had degenerative disc disease and herniations and bone spur at C3-4, C4-5, C5-6. We went in and fixed all three. You will need therapy to increase the range of motion. It'll take time and you'll get better. Are you happy with your decision to come to Deuk Spine Institute?
Very happy. I flew all the way down here from Oxford.
Yeah, very good.
So absolutely made the long trip. I fly back Saturday, and I feel much better flying on the plane than I did earlier. Just thinking, you know, I'm not on any kind of pain medication, none of the muscle relaxant. There's zero pain, so I feel more comfortable hopping on that plane.
And we did it all through a 4mm incision. You could actually see the incision with the little tube going in to your discs. I moved the tube from one disc to the next, and we went back to the back of the disc where the tear was, and I cleaned the tears up with the laser. So that usually does the trick of getting rid of the neck pain when it comes from a herniated disc. And of course, we unpinched the nerve roots that were going down your arm. So that's why your arm is feeling better as well. I don't expect any of that to come back. You should be pain-free the rest of your life. Just don't re-injure the discs.
Absolutely. I'm definitely glad to get my quality of life back. That's the number one thing.
Anything you want to tell your audience?
Anybody that's dealing with the same issues I have, I definitely recommend to come to the Deuk Institute of, you know, laser surgery. It's a wonderful thing.
All right. Well, congratulations.
Thank you
Safe
so much. I
travels
appreciate it.
to
Thank you
and
so
Dad.
much.
And if
We
you-
will.
Yeah.
Well, my dad lives in Tampa, so my wife's up there in Oxford taking care of her stuff up there. So
Okay.
worked out good that I had my dad here to pick me up and drop me off at the airport tomorrow.
All right. Sounds good. Well, safe travels for you then.
Thank you so much. I sure appreciate it.
My pleasure. Good morning, I'm Dr. Deuk. It's December 9th, 2022, and I have with me one of my patients who traveled from out of state, Texas to be exact.
Yes, sir.
And he is suffering with neck pain, and I'll let him tell you a little bit more about his symptoms, but he had herniated discs in his neck along with degenerated disc. We just repaired those yesterday, less than about 12 hours ago.
Yes,
as a matter
sir.
of fact.
Yes, Doc. Yeah.
You're here now on post-op day 1. It was outpatient, no hospitalization. You stayed at the hotel. You're back this morning, and how do you feel?
I feel great, Doc. You know, I just want to thank you right off the bat for you and your team for basically giving me another lease on life. I mean, the back of my neck, the tops of my shoulders. I had pain all the way down the back of my arm, and my elbow, and then also I had no grip. And today, it's all back. I just, you know, it's just a game changer. His procedures, because I've had fusions in the past, like 15 years ago, and those fusions, you don't want to do those because they just give you adjacent disc disease, and I have that problem right now on my back, and Dr. Deuk is going to fix it next week, so I'm very looking forward to doing that.
We'll be seeing him again next week after his back is fixed, but you broke it up into 2 procedures, and we get people all the time asking us, oh, can I come there and get my neck and my back fixed? Yes, you can. We'll probably do it on separate days. So you got 3 discs repaired yesterday. You can actually see right here in this video footage how small the incision is, tiny. And I was in there endoscopically using a laser to clean out the tear and remove the small herniations. And now here, we sent you home an hour after your surgery, and here you are back today. And how much of that pain did we get rid of?
All of it, Doc.
100%.
I mean, 100%. And I mean, doctor did. They did surgery on 3 different levels, and through a really small hole.
4 millimeters.
Yes,
4
Doc.
millimeters. Incredible.
And there's no stitches. It's just a Band-Aid.
Yeah.
You know, that's crazy. You know, if you have a fusion for three level fusion, I don't know how long that would be, but it's
it's about that long for a 3-level fusion. And then of course you'll have swallowing trouble for months, and then you'll have pain, and you'll be on narcotics. Are you on any opioids or narcotics?
No, Doc. Last night I went home and to the hotel, and I just took a Tylenol PM, and that's all the medication I've taken since the surgery.
Yeah. So with the Deuk laser disc repair, you don't have to worry about getting addicted to painkillers because there are no painkillers. Literally a Tylenol, and that's it, because it's so minimally invasive. Far better than ACDF, far better than any other cervical type of surgery. Well, is there anything else you want to tell your fans out there before we wrap this up?
Yeah, I just want to let my parents know and my 10 younger brothers and sisters, if they're watching this, if you have back issues, you need to come see Dr. Deuk, because he is one of the only people in the world that can do this procedure, and it is a game changer, and it's well worth it. At least give him a review. He'll do a free MRI review for you. It's just do your research. Go to his DeukSpine.com, look at his website, and just do your research and give yourself a chance to do the right thing.
Well, thank you. And yes, now I'm the only one, but someday there will be another one
You hope.
who will be doing these
Yeah.
surgeries,
Yeah.
and probably better than me.
Okay, thanks, Doc. Appreciate
Thank
your
you,
help.
sir.
Yeah.
We'll see you soon.
Yep.
Okay, sorry about that. Yeah, we just completed a cervical Deuk laser disc repair, and our patient has traveled from Canada to Deuk Spine Institute to get his lower back and neck fixed. He had a herniated disc in the lower back. We fixed it last week. He had a herniated disc in the neck. We fixed it just now. And his back is feeling amazing. He's praising our work, saying that his back feels amazing. He hasn't felt zero pain in 5 years since his accident. Which brings up the point I'd like to make, which is all disc herniations, 100%, are traumatic. They come from trauma. So here's the interesting thing though. When you have your trauma that causes the annular tear, which then allows the herniation to occur, that annular tear happens in a time of trauma, and a lot of times, of course, the annular tear happens and you may not have back pain, because you have to have inflammation to have back pain. And the inflammation only comes after the herniation. So you can get a tear at the time of trauma, have no back or neck pain for years until you get a herniation. Then you get a herniation of the nucleus material, which is inside the wall of the annulus, comes out, creates inflammation in the tear, and that, my friends, is what causes chronic back and neck pain. So he had both a herniated disc in his neck and lower back. We did his lower back a week ago, and now he's here. We just did a C5-C6. And you could see during the surgery that there was a tear in the annulus at the back. There was the blue stuff, which is the nucleus pulposus that scarred up. It's staining blue. The annulus does not stain blue. You notice it stayed white. That's exactly right. This is a very special dye that we use that only stains the nucleus pulposus. So, and it only stains degenerating nucleus pulposus, basically nucleus that's part of the herniation. So if it's not herniated, it won't stain it. Okay, if it's not degenerated, it won't stain it. But if it is, it will. Surgery went great. We were able to laser out all that material, and he's not going to have any more neck pain. I feel confident. He was having neck pain, I believe some headaches as well. All right, we have some questions.
These next two questions come from Antoinette on YouTube.
Hello, Antoinette. Welcome to Deuk Spine's live stream.
They ask, why not take insurance, and wouldn't this fall under a normal surgery?
Yeah, it's a great question. We do take insurance, actually, Antoinette. We take all insurances. The problem is insurance doesn't pay. And the decision not to pay is not ours, it's the insurance company. If your insurance won't cover the surgery, it's because your insurance doesn't want to pay. So we do take insurance. We take all insurances, but if the insurance is not going to pay for the surgery, well, who is? You have to, the patient. It's your surgery. I've had plenty of surgeries in my time. I just had one done on my sinus. I went to the surgery center. The surgeon takes insurance. The surgery center takes insurance. Matter of fact, they take my insurance, United Healthcare. But United Healthcare refused to pay. So I had to pay out of pocket. So Antoinette, don't be fooled by your insurance company. It's not the doctors that don't take insurance. It's the insurance companies that don't pay. And they will lie to you and tell you they pay. but they won't pay. And in the end, we have to be paid, otherwise we go out of business. It's that simple. And the other question was, isn't this a normal surgery? Yes,
Yeah.
it's a normal surgery. You're absolutely right. Great observations.
And then last but not least, we have a question from and Justice for All.
I like the name, and justice for all.
Yeah, for Melbourne. And they asked, "Hi, Dr. Deuk. Is it possible to have a headache of somebody have disc herniation at the level of C5-C6?"
Yes, yes. So Injustice for All is asking a great question. We talk about this often. If you have a herniated disc in your neck, could it cause not just neck pain, but could it cause headaches that come from your neck and go up the back of your head? The answer is absolutely it can. As a matter of fact, 2/3 of every patient with a herniated disc that causes neck pain will also have the headaches. These headaches have a name. They're called cervicogenic headaches. Cervicogenic headaches are headaches that come from the spine in the neck. And cervicogenic headaches are very common with herniated discs. And when you have this surgery that we just did, the cervicogenic headaches will go away.
And that is it.
All right, I hope you enjoyed surgery. I enjoyed teaching you all a little bit of something today. We will be back in about an hour and a half for our next surgery, which will be a lower back pain patient that has herniated discs. We're going to be going in and doing the Deuk laser disc repair on those discs to repair them so that the back pain goes away. Also, I think they may have sacroiliac joint pain, so we are not going to be including that in the live stream. We're going to have that as a separate stream so that we can capture it on our YouTube channel as a separate treatment, which is the Deuk plasma rhizotomy for sacroiliac joint pain.